Hello, boys and girls, ladies and gentlemen. Welcome to my presentation, solo presentation, structural kinesiology. I did it on knee and leg injuries. I'm Guy Clark. I'm in Callum Dane's class. Let's get straight into it. So the overview of presentation. So I will be discussing name and structural anatomy of the healthy joint, anatomy of the condition/injury, applied anatomy of injury, treatment protocols, and rehabilitative strategies. So let's get started. What is Osgood-Schlatter disease? You might be thinking in your head, what is Osgood-Schlatter's? And I'm here to tell you that it is located at the knee joint. It is a swelling and sharp pain at the tibial tuberosity. As you can see in the image on your screen here, that is what it looks like. It is a lump of your growth plate extending outwards exteriorly. As you can see, it's just below the patellar tendon, which the pressure of jumping and landing causes the patellar tendon to pull on the growth plate, which causes extreme pain, which I've experienced because I had Osgood-Schlatter's before. The syndrome originates in those between ages 9 and 16 who are physically active and in a growth spurt period of adolescence. So as we have a look at the bones, ligaments, and other special structures, so we get started in the bony landmarks. What surrounds Osgood-Schlatter's? We have the distal of the femur and the proximal of the tibia and fibula. So looking at the femur, we have the patellar surface, lateral epicondyle, lateral condyle, the adductor tubercle, medial epicondyle and medial condyle. With the tibia and fibula, we have the lateral condyle of the tibia, medial condyle of the tibia, head of the fibula, and tibial tuberosity, which is very important to know. And we have a look at the ligaments here, so the transverse view and the sagittal view. I won't get stuck into them that much, I won't discuss them that much, but we'll have a look at some of the ligaments that have a very good prevention of injuries. So we have the anterior cruciate ligament, which prevents anterior tibial translation or sliding. We have the posterior cruciate ligament, PCL, which prevents posterior tibial translation. We have the medial collateral ligament and the lateral collateral ligament, which prevents sideways movement. And we have the patellar ligament, which acts as a stabilization of the joint. And then we have the popliteal ligament, which prevents hyperextension. Also, something else to know is the medial and lateral menisci, which is fibrocartilage for stability and cushioning. And lastly, we'll have a look at some of the main movements of the knee joint, which is extension, flexion, lateral rotation, and medial rotation. So the injury, how does this occur? So obviously, having a look at the image on the right-hand side is some of the main muscles and different sort of things that contribute to Osgood-Schlatter's. So it is the inflammation of the patellar tendon pulling against the superior top of the tibia bone. The tibia tendon pulls on the area called the growth plate and gets the pressure from running, jumping, climbing, kneeling, landing awkwardly, swift, rapid, agile movements, and also overuse of muscles. So overuse is really important because I used to, at school, I used to play a lot of basketball, footy, recess and lunch. Used to have footy training, used to have basketball training, basketball games on Wednesdays and footy on Saturday mornings. So there's a lot to cope and a lot of stress on the muscles and also the growth plate, which I had, and it really took a toll on me. So was kind of out for like a year because it sucks. Even though I really wanted to play, it just doesn't work out like that. But yeah, the growth plate is forced exteriorly, as shown as the hard excruciating bump appearing distal to the patellar bone. So we have a short video here, or maybe a couple of minutes long, showing you some exercises and different stretching you can do to help reduce the pain and probably speed up the recovery of Osgood-Schlatter. So we'll have a look at this video.
Osgood-Schlatter disease occurs when your bones are growing so rapidly that your quadricep muscle can't keep up. This causes your muscles to stretch, which places extra pressure on the tibia, where your quadricep muscle attaches. In some cases, a painful bump may be present. Fortunately, stretching and strengthening the muscles around your knee with these 5 easy exercises can help relieve pain from Osgood-Schlatter disease. Let's begin by doing straight leg raises, which help strengthen the quadricep muscles located on the front of your thighs. Begin sitting down in a straight leg position with your back straight. You could place your hands behind you for extra balance if needed. Then you're going to raise your leg about 10 inches off the ground, hold for a few seconds, and lower back down. Start by doing 3 sets of 8 to 12 repetitions. Next, we're going to move into a single leg squat, so you're going to need to grab a stiff chair. Slowly stand up with one leg using controlled movements until you reach your full height. Hold for a few seconds, then place your raised foot on the floor and slowly sit down again. Repeat this exercise for about 1 minute. Okay, now let's stretch out those quads. This stretch can be performed while standing or laying on your front. Pull the foot of your injured leg towards your buttocks until you can feel a gentle stretch on the front of your thigh. Hold this stretch for about 30 seconds and repeat 3 times. Now we're going to move into an exercise that helps strengthen your hamstrings and glutes. First, lay on your back with your knees bent and your arms to your side. Then, using both feet, push your hips towards the sky. Hold this position for about 10 seconds and lower slowly back to the ground. Begin by doing 3 sets of 8 to 12 reps. If this exercise is too easy, move to single leg bridges. Finally, let's stretch out those hamstrings. Sitting at the edge of your chair, straighten one leg out in front of your body with your heel on the floor and your toes pointed towards the ceiling. Then, sit up straight and try pushing your navel towards your thigh without leaning the trunk of your body forwards. Hold this position for 30 seconds and repeat 3 times.
Well, there you have it. Hopefully these exercises for Osgood-Schlatter's disease can help decrease your knee pain.
Give them a subscription. So, sorry about that. Let's get back in. So following on from the video, treatment protocols. So stretching, obviously the quadricep and hamstring can't cope with the amount of growing and like the growth span of your knee and leg. So it's best to stretch the surrounding muscles such as quadricep, hamstring, gastrocnemius, soleus muscles. Less exercise, so just doing less and more rest, which will ease the pain. See a physiotherapist if you're unsure what injury you actually have. So it might not be Osgood-Schlatter's, it could be shin splints, could be something to do with the ankle. Surgery in extreme circumstances, so hopefully no one has to go through surgery. Rehabilitative strategies such as activity modification, so doing less activities and more rest, like I said, to ease the pain and to speed the recovery. RICE, so rest, ice, compression, elevation. Medications such as painkillers and anti-inflammatory and deep heat. I'm sure a lot of you would use deep heat. I use it, it's pretty good. Compression bands around the growth plate. I remember in school I used to wear a growth plate as well. In school I used to wear a compression band as well. And some of the exercises I had to do at home, given to me by my physiotherapist, was some wall sits for a couple of minutes, bridges, leg raises, and foot plantar flexion, dorsiflexion. I also had to use a foot insole as well. And that just wraps it up. That's my references. And yeah, hope you guys have a great evening.